How do you kinesio tape a shoulder? In this video, you're going to learn how I kinesio tape shoulders in my practice for shoulder pain and posture, as well as 3 pro tips that doctors use to make kinesio taping easier and last longer. Coming up. What's crackin'? It's Dr. Neville, aka Dr. Ginger Ninja. If we haven't met before, I'm a sports chiropractic physician, USPTA tennis pro, and medical director at Sport and Spinal Rehab in Jupiter, Florida. On this channel, I explain different types of injuries and the treatments needed to eliminate your pain and get you back in the game. If you're new here, consider subscribing. And at any point in this video, check out the description below for more information and links to the kinesiology tape and equipment that I use in my chiropractic office. With that being said, let's get cracking. What is kinesiology tape? Kinesiology tape, also called Kinesio tape, is an elastic therapeutic tape that helps support joints and muscles. Kinesio tape is different than traditional athletic tape because of the elastic properties as well as the wave adhesive pattern on the back. Instead of restricting movement like traditional athletic tape, Kinesio tape adds support to the joints and soft tissue while still allowing full range of motion. Since Kinesio tape naturally doesn't like any oils or lotions, use some alcohol or soap and water to make sure that the skin is prepped and cleaned. Pro tip number 1, round the corners of the tape and it won't catch on clothing and it will last longer. For today's taping, we're going to use a 12-inch and a 14-inch strip of tape, as well as a 10-inch Y strip. To make a Y strip, cut a 10-inch piece of tape down the center lengthwise and stop about 2 inches from the end. Pro tip number 2, to remove the tape from the paper, don't try to peel it from the edge. Instead, tear the paper from the back and then peel away. Step number 1 to kinesio tape a shoulder is to apply the Y strip. So tear the edge, we're going to apply the end on with 0 tension at the base of the deltoid. Have the patient bring their arm across them to stretch the posterior deltoid, where we're going to apply the tape on around the posterior deltoid to the top of the shoulder at approximately 30% tension. Then bring the arm to the low back, where we're going to bring the tape around the anterior shoulder to the other strip at approximately 30% tension, no tension on the end, and relax the arm, and with that applied, it'll look like a big oval. Step number 2 to kinesio taping a shoulder is applying the 12-inch strip to the outside part of the shoulder. So again, you're going to apply the end with 0 tension to the front of the shoulder. Have the patient go into external rotation of the shoulder and shoulder blade depression in really good posture, and you're going to apply a higher tension, approximately 50% tension, around the outside of the shoulder along the external rotators. Bring that down to the mid-scapula and apply the end with 0 tension. Step number 3 of applying kinesio tape to the shoulder is applying the 14-inch strip to help the shoulder blade depression. So you're going to again anchor the front of the shoulder with 0 tension. Pulling at approximately 50% tension, we're going to come over the top of the shoulder, coming down the shoulder blade, and you're going to end that at the mid-back, just below the shoulder blade. Pro tip number 3, once you're done taping, make sure you rub the tape to activate the adhesive so the tape sticks and lasts longer. In today's video, we demonstrated just one way to kinesio tape shoulders for general shoulder pain with poor posture. But there are a lot of different ways to kinesio tape shoulders based on specific injuries, which leads me into the question of the day. Do you have shoulder pain and found a certain taping technique that really helps? Let me know in the comments below. Thanks for watching, and if you found this video helpful, do me a favor and punch that like button, subscribe, and we'll see you in the next video.